Hello, and welcome to today's episode of the Scottsdale Living Podcast. I'll be your host today, Dr. Amber Enright. I'm a doctor of physical therapy who is also part of this big community that is Scottsdale Living. And I have someone I've been chasing to get on the podcast for years now, my friend, Dr. Mary Kay Geyer. Dr. Geyer is a naturopathic medicine doctor. And when we talk about naturopathic medicine, a lot of people really aren't sure what it means, what it is, what the training is behind it, and what it means in medicine. And I wanted to bring her on to discuss that because, one, she's not shy or timid. She is an educator. She is a provider. She is a mother, and she is an excellent communicator. So this episode will be really fun. She owns Empower Integrative Health. I've been actually referring patients to her since I met her. And not because like, oh, hi, we're friends and I like you, but immediately the patients that I was getting really firmly trusted her. And I have a thing in healthcare because I'm a physical therapist and I ask people all the time, so have you had physical therapy before? And they're like, yes. And I was like, well, what did you think about therapy? And they're like, well, my therapist was really nice. They were the nicest. And I just don't think that that's necessarily the threshold that we should be accepting when it comes to healthcare. Like, I like that providers would be nice, but I think there's a bigger depth here about people giving you sometimes answers that you don't want to hear, people being able to deliver messages quickly and in a succinct way that makes sense to us and not speaking over our heads, especially in medicine. So I wanted to bring on Dr. Geyer because I know you're going to hit all of this on the nail for us. And before I do, another impressive thing about Dr. Geyer is she taught for 10 years at the Naturopathic school here, the Southwest School. It's in Tempe. And she taught there for 10 years. So basically all the naturopaths in the state know her. And then she also founded Naturopaths Without Borders. She has globally served and founded some of well, you went to Haiti, correct? And so I just have the utmost respect for the things that you've done community-wise, globally, and in our local community, and for some of my patients as well. So thank you for coming on. Welcome to the show.
Thank you so much for having me.
Absolutely. I know that you hate public speaking, so I hope you like this environment a little bit better.
I actually love public speaking. It just depends on what I'm talking about.
Okay.
Yeah.
Okay. I like it. So we're going to get into some of the nuts and bolts here, but the very first question everybody has is, what the hell is a naturopathic doctor?
I think this is the most confusing and part of it. So I'm going to try and tease this apart and unpack it. Part of it is that every state has different licensure. And so in some states, we're recognized as a physician. In some states, our title is protected because we're a doctor. And so in Arizona, I'm a naturopathic medical doctor, just like an osteopathic doctor. So I'm a doctor with a full scope of practice. In some other states, they don't protect the title, they don't recognize it. So that gets very confusing because somebody could have done an online program for 9 months and call themselves a naturopath. And then down the road is somebody who did 4 years of undergrad, 4 years of medical school, and then a residency, and they're also a naturopath. And so there's some confusion there from state to state because every state gets to set their laws and their rules, and it's a little bit different in each state. So there's naturopath, which usually means someone who did either a lay training or some kind of online certification. And then they often call themselves board certified, which is a little bit confusing too.
Wow.
Yeah. And there's a whole thing.
That is confusing.
I was confused when I started to look into this medicine myself. So that can be really confusing. So there's a naturopath and then there's naturopathic physicians, which is different. This is also one of the states that protects naturopathic medical doctors. So you'll see naturopathic MD a lot here so that people understand that we're a medical doctor because there's some confusion there. And so that's like kind of the first layer of it. And then people choose to practice differently. I think sometimes they kind of overgeneralize where some people want to do homeopathy as a physician, and that can happen for an MD too. I think it's just less common for an MD or a DO to do that. So sometimes they'll think, oh, you must be a naturopath or a homeopath. So that I get homeopath a lot too. And I'm like, I don't personally do any homeopathy. I love it. It's wonderful. I refer to people who specialize in that, and that's all they do all day long. And so that's kind of the most common misconceptions that I've found about, are you a real doctor? What's a naturopathic doctor? And then like, oh, but my homeopath. And then, from there.
So essentially the terminology is the part that's confusing. And then in each state, there's such variability. So you are an NMD, a
Correct.
naturopathic medical doctor.
Yeah.
So when people think of you, what should they think of as the classic training, or what was your training to go into this? Because in medicine right now, there is a war. There's a real war going on internally and even in our state. And it is like it's medical doctor physician versus naturopathic medical doctor. And I don't like it for a variety of reasons. One, because I know that it takes a team to serve many patients. I treat very complex patients, and I just visited one today at Barrows, and I saw 3 different providers. Absolutely none of them stepped on each other's toes. They did not give contradictory information. They worked as a team. Now, I'm sure they didn't meet in the hallway before they came in and gave me information, but they understand that they work as a team. And so to me, having someone on the fringe or having providers that necessarily don't understand each other's roles or understand how they can work better together is absolutely a loss. So tell me about the training so we can clarify it. And then tell me about what you think that war is over and then how we can do better.
Okay. I'm gonna try to break this apart. So the education itself is standard across the board, right? We have to have standardized education. So it doesn't matter if somebody's an ND in Tennessee and they're not recognized, or they're an ND here. In order to be an ND, we have to do 4 years of undergrad. We have to have all of our prereqs, just like going into MD school or DO school. You have to have your specific criteria of organic chemistry and all of these things. And so mine is, I had a bachelor's in science of organismal environmental biology with a minor in chemistry and a minor in English. And so that was my particular choice. But you could do anything in those 4 years as long as you hit those prereqs. And that's for any of the medical schools. So it's the same leading in. The difference is entrance-wise, when you choose the 3 options for your medical school, there might be different entrance exams for that. So that's one piece. Then we all go 4 years. And so I think that this is where there's some confusion. We all go to a 4-year medical school. And so our 4-year medical school curriculums have to be almost identical. They also don't know that. So we have to have the same basic sciences. We have to have the same, clinical courses and didactics and, same patient hours. We have to have clerkships where we're rotating through and seeing patients, under our attending physicians. That's all the same. And so just to clear that up, and in many of the schools they have side by side, we actually have a lot more hours, both clinically and throughout school. The reason is we start with that 4 years of what we are required, because we also have step 1 and step 2 boards, just like they do. So ours are NPLEX, theirs are USMLE, they're standardized, of course. And so we have our boards, and we can't get into clinic until we pass our step boards as students and start our clerkships. We can't graduate and sit for boards until we've taken, we sit for boards with those second steps. So that's pretty much the same. Here's where it kind of tears out and gets confusing for people, is that we have to do all the additional education. So I had to have 2 years of nutrition. I had to have 2 years of acupuncture. I had to have all of these other botanical medicine, mind-body medicine, so there's homeopathy. And so we get oftentimes 2 years of each of these on top. So when I went to medical school, this was like a joke between me and my previous husband, who's also an MD. He was like, your medical school was way harder than mine. And by the way, he went to University of Arizona, Phoenix campus, first graduating class from there. And they're all brilliant. And I love that program. I'm actually really impressed by their program. The difference, though, is that they didn't have to sit from 7 a.m. until 9 p.m. Monday through Friday and then do Saturdays and Sundays. So we went year round. So year round, oftentimes 5 to 7 days a week in order to fit. Because if you go and you're taking all the biochemistry and the anatomy and the neurology and the urology and all of these ologies that you have to take, and then you add in, okay, well, you need to know all of these natural modalities on top of it. And in Arizona, we have within our scope acupuncture. We have to sit for acupuncture boards. So that's different than any other state, which means that we have to do all of that training on top. Even if we never practice it, we have to sit for those boards. Or at least when I went to school, you had to sit for those boards. I think now you could skip the acupuncture ones if you're going to another state. But minor surgery, everything, it's all in there. So it's really, really full. And then after that, depends. So This is the biggest issue that a lot of our MD colleagues have with us, is that that's not standardized per state either, is residency requirements. Most people don't know that residency requirements aren't standardized in the MD world either. And so they're becoming more standardized, but they haven't always been that way. So depending on, what program, you might do 3 years of emergency medicine, you might do 4 years of emergency medicine as a resident, you might do family practice is different. And so that varies, but it has changed over time. So the
Wow.
residency part is a little bit confusing. We only have, our base has to be family practice in our residencies. And some states we are primary care. So Oregon and Washington, things like that, Vermont, we're primary care physicians. So I did my residency in primary care, and I did an intern year and primary residency after that. So I've got 2 years of additional education after that. And then there are still, now we have fellowships. And so those are all fellowships. Like if somebody wants to go into oncology, they have to do, they have to become a fellow, and there are fellowships there. There are cardiology fellowships. There are all these different, so they can move into these specialties within that. So the tracks are actually almost identical. It's just that we get natural medicine on top of it. And then the residency isn't quite as like streamlined where everybody's doing, like everybody does their family practice and then maybe they do a fellowship. And because there's not standardization in every state, it depends on like, well, does it matter if they do a fellowship and they want to do oncology and they go to a state that doesn't even recognize them and everyone thinks they're a health coach? They're probably not going to. So that's where it gets a little bit fuzzy for some people.
Well, I feel really bad because essentially there are so many other providers that don't know what one another does. And with your field in particular, after you're telling me, our tracks are exactly the same as medical programs. And when we come out in many states, we won't even be recognized as physicians. And obviously, there are some misnomers there as well, where you just mentioned, like the term health coach. No, a health coach is like, you just call yourself a health coach and you go online and market yourself. You don't even have to have a piece of paper that says you are. Even though there are like certification coaches, there's programs. What we're talking about is something completely different. And so essentially what you're describing is like a full level of disrespect from not just like the public not understanding, but from medicine in and of itself. And I feel like I can kind of relate to that. I am not a physician. I don't pretend I'm a physician. I have a doctorate degree. It only says that I am great at musculoskeletal work. When I work with patients who have neurologic disorders, I have to be able to verify that I have the skill set to treat them. That came from additional training, not what they provide me in school. So just like residency for medical schools or fellowships for physicians, you guys have the same thing.
Mm-hmm.
So in Arizona, those are well standardized. That's what you're saying.
Pretty much, yeah.
Okay, that makes me feel better because I practice here. This is where I plan to stay. And so whatever other states are doing is really not even of my interest. But to know that I can rely on someone that they have a certain level of education behind their degree really is the top of the day question in healthcare. And I say that because there are a billion people selling you stuff on the internet. And I hear this from every provider who sits across from me in the chair is that one, the income for some people who are branding themselves as some kind of expert that don't have the education behind it is sometimes even more than what the real provider has made. The one that went to school, the one that paid for their degree, the one that has the actual knowledge. And so it's interesting that the internet trusts people so much.
Yeah. It's also really interesting. So I've had 4 people shadow me this week, 2 fourth-year naturopathic medical students, 1 nurse, and 1 physician's assistant. And the physician's assistant was interested in functional medicine. She came in. She really had no idea what I did at all, right? She didn't know who I was. She came from Tennessee. That's why it's fresh in my mind. And so that was a really interesting conversation around it. And so she and I started to talk about student loans. And I was like, okay, well, I like to connect people within the community. Like the nurse that came in wants to get into integrative medicine. My office is completely full. my staffing. And so I said, okay, well, what are you looking for? What's your salary? And I did the same thing with the PA. She told me her salary, and she's like, well, I need to pay my student loans. And I was like, I completely understand that. And I think that that's a really important topic. And we started talking about student loans, and she didn't realize that my student loans were the same as an MD.
Mm-hmm.
And I was like, yeah, they're exactly the same. The difference is that I can't take insurance in the state of Arizona because Arizona left it up to the insurance companies to decide whether or not to include us. And they've excluded us in this particular state. So I don't qualify for loan forgiveness or any of those programs. And so that changes the dynamic here. So there's a lot of those pieces. And then you've got the public who's like, wait, I'll pay my MD $400 for 15 minutes because I don't have insurance, but you're charging X amount. That's really expensive.
Mm-hmm.
And it's like, wow, so that's kind of interesting. Do you mind if I address your last thing that you said before, though, as you were kind of leading up to this, is the contention within medicine? So when I first graduated, so I've been doing this for 18 years in practice. And when I first graduated, it was so in my face apparent. I just couldn't believe it. Like everywhere I went, it was like, oh, you're not a real doctor, this, that, and the other thing. I don't believe. Luckily,
naturopaths get hate, man. You guys catch a lot of hate, like fire.
There's some serious hate. And luckily, there were enough wonderful MDs out there, and in academic medicine. So this is where I want to kind of tease it apart. Having done a residency and then spending 10 years at an academic level in a teaching medical center, working with other teaching medical centers, we don't work that way. And so that's where it kind of changes is those MDs do the same thing we do, is that they may stay in academia or they may stay in a large hospital system or something along those lines, or they may go into community medicine. Community medicine docs, private practice docs, there's a lot more leeway to kind of like get comfortable and get lazy, get into your ways. And like you also get kind of disconnected. And those are the ones where I usually get the most amount of pushback because otherwise, I'm just a physician who is working on coordinating my patient's care, and their care team. And so when I reach out to, this physician at Mayo and I say, I'm calling about a patient that I'm seeing that you're also seeing, and I'm managing all their primary care and making sure that all their specialists are coordinated. And I see that we have this going on and I want to have a conversation about it. They're generally really good at having that conversation versus if I call a private practice doc and like, let's say rheumatologist, some random place, and they'll be like, wait, you're a what? Right? And they just don't have that. So that seems to have, it seems to be partially because in medical settings where we have to collaborate care, there is no ego. Like you were saying at Barrow, it's like, we just have to get on the same page for our patient. So that's shifted in medicine a lot.
It's beautiful.
I was
so relieved to see that this morning because we are post-pandemic. And I mean, it's like 15 times a week that you essentially hear the like COVID excuse from everyone. I mean, it could be someone who, like if I was at the gas station or at a hospital, every level was tainted by this like excuse that we don't have staffing and we can't do our jobs appropriately. And so to walk in and see at Barrows that was not happening this morning, I was so relieved. I walked out reminding the family of my patient who was not there. And I was literally giving them an update. And in real time, I told them, you don't have to do anything. Rest assured, you're all in the right place. He's in the best hands possible. And we have no control over the situation. Good, bad, or ugly, we don't. I felt so good about saying that. And they all felt relieved just from hearing that we have trust.
Yeah.
We have trust. And when it doesn't happen, it's this. It's a bunch of finger pointing. It's a bunch of you look ugly over there.
Yeah.
It's literally insults flying. People are undermining the trust in other providers. That's like the worst thing that can happen, right?
Yep.
Like, and it happens in every discipline. Like there used to be a war between chiropractors and PTs. And I realized getting into further years of practice that it was nonsense. There are absolutely amazing providers in every profession and terrible providers in every profession. And, just like to your point, when I went to PT school, I went to one of the cheapest programs in the country. And I love that because my peers getting doctorates were all graduating with $200,000 in student loans. And the starting pay in Arizona for a PT was $55,000. We are still the teachers of healthcare.
Mm-hmm.
And so to act like it wasn't because we didn't get the right education is incorrect. We
Yeah.
paid for the degree that we got. I say I went to the cheapest program because I lucked into it going to NAU. I went to an in-state school, thank goodness, and then went to grad school at the same place. So my degree was less expensive, but we were ranked 9th in the country. That's why I went there. I wanted that big bang for buck. And I knew, you don't just get free money. That's not the thing. But people forget that
Yeah.
when you get out on the other side, you owe it. And you owe it to yourself to then find a job that makes that up because you have bills to pay. You have goals. You want a house. You have many children. You have many children at home. You're still giving back to your community. You're still finding ways to employ your resources, not just in medicine, but literally in your family and in your community, in your relationship. And I think that what I'm saying is I look up to you a lot for fighting this good fight about helping people understand without offending them what you do. Because there's not going to be a lack of understanding. That's always going to live there. And in the face of essentially adversity where people were really doing that, the last 18 years, I had actually never heard of naturopathic medicine until I moved to Phoenix. That was 2015. And so when I think about that in medicine, I'm like, wow, it's not as new as I thought, one. Two, when I think of levels of expertise, like I said, there's good and bad and ugly in every single profession. But when I think of you and the level of expertise and what your patients actually described to me, and the reason that we met initially was that I had found an expert in her field and I needed to know more about what you did. So thank you for that. And thanks for being a good advocate for your entire profession. So saying that, why did you go to naturopathic medical school? Your husband's going to medical school. You're going to naturopathic medical school. Why did you do that? Why didn't you just say, you know what, I'm going to pay the same money. I'm going to go be a physician. What drew you in? Tell me.
What drew me in? Oh goodness. Let's go into the depths of what I was thinking as a 21-year-old. No, actually, I got really sick. So when I was in medical school, I joined the military. When I was in undergrad, I joined the military, and I got very sick very quickly, and I was having a lot of health problems. And then all of a sudden, I gained 35 pounds in 2 weeks, and I stopped getting my period, and I was always sick, and I had walking pneumonia for 6 months, but I didn't go to the doctor. So, you know how I am. We're not always so great.
She said, you know how I am.
Even
the
before
doctor
we were
said,
diagnosed,
I don't go see the doctor.
I didn't have any knowledge then. I just didn't go to the doctor. So I was just really sick all the time. Nobody could figure out. And I went through this cascade of doctors. And so I was probably 20 at the time. And I went to MDs, and I'm in New York for context. So this is some of the supposed best medical care in the US, right? People would argue in the world.
Mm-hmm.
Yeah. And so I'm going to see OBGYNs. And finally I broke out and I was like, okay, you guys have told me that I'm in premature menopause, premature ovarian failure at 20 years old. Whoa. And that I will never have kids and I should settle in. Nobody even had a hormone discussion with me that if I was going through ovarian failure at 20, that I should probably go on hormones. So, it started at urgent care, like these things often do. And then I went to primary care, and then I went to another primary care, and they referred me to an OB, and then that one referred me to another OB. And then so I'm going through these levels, and then I'm looking at endocrinology, of course, because everything's all messed up. And then I get referred over, and I'm like, you know what? I'm going to try acupuncture, and that's just craziness. And so I'm like, whatever. So I try acupuncture. I go see an herbalist. I go see a chiropractor. I go see energy healers. I don't even know. There were crystals involved at one point. I would freaking try anything because I'm 20, and the idea of menopause, I'm like, are you kidding me? Probably the idea of me gaining 35 pounds in a blink of an eye was probably traumatic to me at 22, without having any answers. But I also just was sick. I was tired. I was it was terrible. And so I had been seeing a chiropractor for years and years. And he said, if I had to do all again, I would have become a naturopathic physician, and I would have gone to Bastyr. And so I was like, what is this? Because I was already headed to DO school. That was my plan. Because I didn't really like the medical, I had grown up sick earlier on. I'd had some kidney disease as a kid, and I'd been in and out of hospitals, and I was premature as a baby. So there were all these things that had happened in my early childhood up to my early teens, and having kidney disease in your teens and going in for these very invasive exams that involved you obviously getting catheterized often. And
Oh my gosh, as a
so
teenager.
that was that was earlier on. And so I'd already decided that I wanted to be a doctor and I wanted to be one of the good ones. And that was like all I thought about. I just want to be one of the good ones. Like I just, I had a couple good doctors. My pediatrician was really great. He never pronounced my name right. I loved it. He called me Marika instead of Mary Kay. And and then I had another really good specialist in a hospital who was kind and had good bedside manner. And, I'm assuming he was a pediatric urologist looking back on it. And so I had this set up and then I'm talking to him and I'm like, well, let me look into this. And, everybody's like, don't look at this. Just become an osteopath, be a real doctor. Right. And then I'm confused because I'm in New York and I'm looking at like Trinity College or whatever it was at that time that had a naturopath program and their board certification. And of course, I'm like, hey, I can go 9 months or 4 years. And then I delve deeper and I'm like, wait, there's board certifications. And if I want to be a physician and so then I toured the schools. And so that's kind of how that bifurcated. Now, fast forward just a little bit. I saw one ND. I did a couple of super basic things. And 2 weeks later, I had a period.
So fast.
That
just like,
rocked my entire world.
Wow.
Entire world. And then just randomly, I was going to Bastyr, but I was sitting across in comparative vertebrate anatomy lab across from some woman talking about how she'd come to Arizona. And I asked her about it because the only thing I knew about Arizona at all was that they had a school here. And she's like, oh, you wouldn't know it. I went to see this school and tour it. So she and I later moved to Arizona, was my roommate in medical school.
What?
Yeah. So super random, but that's how I ended up not going to
crazy.
Bastyr and coming to now Sonoran University of Health Sciences.
I had no idea about your backstory, so thank you for sharing that. Quite the adventure, honestly. And I want to say I'm sorry because clearly medicine at that time had brutally failed you, like just kind of dropped you out. And I think that unfortunately, that's the conversation that we're having about medicine right now is like people just are not believing in the normal system anymore. Again, is it lack of communication? Is it because medicine is taking some big strides right now? Like things are changing rapidly. The options, there are trending treatments and everything. And then there is what medicine is currently doing. And 20 years ago, I couldn't fathom what medicine is doing right now. And I say that with also knowing that sometimes we're kind of advancing what we're doing with patients before we have all of the data. 2019 and 2020 very much proved that sometimes we're willing to give the science some leeway before we have all of the data to collect on how it will impact people. And who knows? I don't know. I don't know what science will say, what the research will say in 50 years, but there are some things out that I'm just like, do we not have common sense? Do we not have common sense? Do we really just go and get a treatment from anybody for anything now? Do we let anybody buy a laser and put it on my face? Like, what is going on? So how are you feeling about that the trending treatments versus what you know to be true? Because clearly you met medicine at a time where you really needed medicine to be excellent and where medicine failed you and you ended up finding your passion and your future and your direction from that failure.
Yeah.
Like, hey, this is underserved. I hope I can help people just like me who can't get answers. And I know that you call yourself the weird shit doctor. And I know it's true because you do see all the people who've gone to, I'm not messing around, at least 10 providers and have not found the answer that they're looking for. And they're not guiding you, And then all of a sudden you're like, oh, did anybody ask you about this? Okay, great. And we're on a track right now. And just like what you said, I'm honestly shocked that you had resolution in 2 weeks. So talk about that.
So before I talk about that, I just want to kind of fast forward to my residency because this is really integral for the type of physician that I became. Because one of the things, having been married to an MD during medical school, he always pushed me to be evidence-based. And so I think that was a really wonderful thing is that oftentimes I would get excited about something and he'd be like, but what's the evidence? And so I really had to go into that. It changed the way I became more and more analytical about those sexy therapies as they like came up, or like this fancy new supplement, or like this medication that we think may, or a new study. And so that was super helpful. And then we had our first child when I was in my 6 months before I graduated medical school. Super great idea. And
Oh my God.
before residency, it seemed like it made sense timeline wise. And so he was really sick and we couldn't figure it out. And so he was continuously sick. He always had pneumonia. He always had UTIs. He always had these things. He was always running fevers. He wasn't developing. He didn't hold his head up at 10 months. I saw 4, 5, 6 pediatricians before somebody said, I think something's wrong that your baby's not holding their head up. And she was an osteopath, mind you. So like, again, good physician is a good physician, pediatrician. And she said, we need to start working him up. I think he might have autism, which was like heartbreaking for me. And so then I went through the realm of this like beautiful new baby boy and like doing, genetics and neurology and endocrinology and all of these things. And then at one point, I saw an endocrinologist that told me he had mucopolysaccharidosis. And I was sitting in his office and he's like, well, you know what that is. You're a resident. So I'm a resident at this point. And I was like, great. So you're telling me that my child is going to die by the time he's 4. And he was like on the phone with his own resident. He got off, he got on, he got off, he got on. Tells me that he thinks he has this, because he also had like enlarged liver during this time, the entire time from time he was born until, a few years old. And so then he's like, oh, you know what this is, right? And then he's like, here's the test, and we're probably going to need a liver biopsy definitively, and da-da-da-da. And then he walks out, and I'm in the car afterwards. And first, then I walk out, and I'm like, am I done? Like, I don't know what to do next. I'm like wandering around the hallways of his like clinic. And I'm like, this is so fucked. Like, why is this so nonchalant that you just told a mother her child has a genetic inborn error of metabolism, or like these crazy, scary things that you tell people. And like, like there was nothing. And I'm in the car and I'm crying. And I'm like, I think I probably called my husband at the time and like was crying, and he was like calming me down. But later on, that guided me to figure out what kind of doctor I would have wanted to be, because I was probably a cocky medical student, because at the end you get kind of like, you get your senioritis. And I knew I'd worked hard and I was really good. And I was going to, graduate with good grades. And, I'd gotten my residency that I wanted, matched correctly and all that jazz, and so that really like knocked me back. And it was like, wait, what, totally the way that I approach things. So that changed the trajectory of the type of physician that I was. So there's that piece. Okay, what was the rest of it? So back to your last question.
We're talking about just trending topics and trending medicine. And where do we go for trust, essentially, when we aren't sure? The public.
Yeah. This is so funky right now because, first of all, like what's on the news is whatever they decide to put on the news, right? So it's not like good, bad, or indifferent. It just is whatever randomness. And then there are lots of physicians. So I'll use another example of myself being a patient, because I keep getting reminded of like what isn't still not working. 5 years ago, I was in a car accident. I was rear-ended and T-boned, and I ended up in a neurologist's office. And I remember saying like, hey, I'm thinking about hyperbaric oxygen. He said, there's no research, right? And you're like, have you opened PubMed or the Cochrane database or any of those wonderful trusted databases that we actually look at every single day as medical doctors to like look at what research is out there? But the general public doesn't get that. They don't know how to do that, right?
No.
They're not going to like critically analyze the evidence of, I mean, a bunch of the studies on there. Just because it's in PubMed doesn't mean it's a good study. It means that, it ended up on PubMed. That's where Cochrane is for. That's more trusted. That's more vetted. But nobody's going to know that out there. So that's tough. Now, the good news is, good, bad, indifferent, I think in the last like 5-10 years, is we have social media. And so social media has made all of these wonderful videos and reels, and people they have more access to more interesting things. And in the last 5 years, I've seen more physicians get on there and talk about real information. And I'm excited about that, because it's not just like people are able to access things and then they're able to bring it to their doctors. It's up to the doctors after that to actually like, all the time I tell people, I say, I don't have any knowledge of this. Like I cannot make any kind of educated decisions or give you any educated feedback until I go educate myself. Let's talk about this at your next appointment. And then I make a little note for myself, right? And so we have to, because There's like the sexy things coming out, and I use a lot of them. It's just, how do you use them? It's like I use peptides, I use methylene blue, I use exosomes, I use a lot of low dose naltrexone. I use a lot, lots and lots of IVs in my practice, advanced IVs, EBU, NAD, and there's just more and more stuff all the time. Like, oh, now we hear metformin given to a rat, and like, oh, but what about rapamycin? And you're like, okay, well, we're figuring that out, like, how do you vet that? And we're all just doing it in real time. It's up to the physician. I hope the public reaches out to good people, and like, gets their information is the best thing. And you were talking about on every single corner. That's another tough thing, is that that doesn't mean that they're any good. You're right. Like, how many people are injecting Botox and like fillers into people's faces that have, really should not be. And physicians do the same thing, because after we graduate from the physician stage, you're expected to just get whatever certifications and education you need, unless there's like some kind of specialty, where there might be something in place, or some states have put things in place. And so that doesn't mean that they did. It doesn't mean that they trained in hormones. Everybody's doing hormones. Like,
Yeah.
if I'm treating the whole person, I'm doing hormones, but like, that's the sexy thing. Like, I need to know hormones, thyroid, weight loss, all of those. And so, yeah, it's tough. It's a messy world where we have more access to information and misinformation than ever.
Well, I want to talk about peptides now, because, and you can correct all my terminology, because I'm not going to go into details about which ones and how I should title them. You can do that for me.
Mm-hmm.
But I know there's a peptide for basically everything right now. I mean, I have a friend who is essentially nearly albino, and she is tanner than I am now. And she's been using a tanning peptide for over a year.
Yeah.
And I just it was so important to her to be tan. One, are peptides safe? Are they safe for long-term use, or are we doing something unnatural to our bodies that increases the risk of other things? Like, I can put colored contacts in my eyes, but at the end of the day, my eyes hurt.
Yeah. This is an ongoing conversation that is super sticky. And so I don't know if you're aware, but the FDA stepped in last year and banned a bunch of peptides. And so people have asked me over and over, and I'm like, I'm not the FDA. So first of all, it's not like I have some insider information over here. Like, this is what the FDA did and why. Right.
Yeah.
But my suspicion is that there are a couple of things. One of them is, all of a sudden in the last couple of years, I watched a bunch of influencers go online and give a discount code to their peptides. And I'm like,
specifically for like weight loss.
Not just weight loss.
I saw weight loss everywhere.
I saw lots of sermorelin, ipamorelin.
What is that?
So those are used a lot for to increase growth hormone and testosterone and lean muscle mass.
Okay.
So we're kind of looking in that,
Nice.
Lots of bodybuilders use them. They do lots of other things. And so I started to watch this, because there were lots of these out there where it was like, okay, there's dihexa for memory, there's all these different ones. But I got scared for the general public. I'm thinking, okay, well, wait, so you're like now a health guru because you wrote for some magazine, but you have no medical background at all, or nothing. You're a health, I don't know what you are. And you're like talking about these peptides. Yes, talking about these peptides. Here's my discount link. These are injectables. We're not talking orals, we're talking injectables. And I'm like, oh, so maybe you should just be quiet. And so it made me a little bit scared at that point in time of like, what would happen with those? Because patients can have an anaphylactic reaction to anything. They can have reactions to things. Peptides, some of them are incredibly safe. Some of them have more research. Some of them have less research. They're coming out with new ones every single day. So when those went off the market, I got emails from compounding pharmacies about new ones to replace them that they were coming up with. And so, that there was that piece too. And then there are also some medications that will be extremely expensive that are in coming up here soon, that just happen to be, the same version of those peptides that were just banned. And so that's a whole other discussion that I won't get into here. That's for another day, but yeah.
So, I know a lot of people who have taken weight loss peptides and essentially are losing their hair. They have lost weight, but they're scared because every time they try to reduce their dose or come off of it, I think they constantly feel hungry again.
Yeah.
And is the peptide really just appetite suppressing, or is it changing their metabolism to burn all, does it burn fat and muscle? Does it target a certain type of energy burning? So where are we with that? And how healthy is that? And can people get off of them?
Yeah. GLP-1 agonists are like a whole other topic. And boy, I mean, there's so much there's a lot of debate. There's a lot of contention. People love them. People hate them. For diabetic patients, that's one thing. But when we start to talk about weight loss and apply diabetic medications that are that complex to weight loss, we're talking about a lot more. So there's a lot of like misunderstanding around them that they're like insulin secretagogues, that they're going to increase insulin levels. And in a diabetic, they increase insulin levels so that the insulin will go out. So can I just explain diabetes real quick?
Yeah.
Because I'm going to assume that people really don't understand this. So when we eat glucose and it gets absorbed into our bloodstream through our GI, we ate that donut, yet broken down in its most simple form, it went into our bloodstream, it's floating around, it needs to go store in our cells. It can go knock on the cell and the cell won't recognize it. So our pancreas makes something called insulin. Insulin, this is very not the best scientific explanation, but it makes more sense. Insulin and glucose go up to hold hands. Insulin knocks on the cell. And cell says, hey, come in, I'm going to store you. And then insulin resistance comes from when you keep bombarding it with too much sugar, it finally pulls down its receptors and says, no, we're closed, like a parking garage that's full. And then insulin and glucose are just floating around in your blood and your glucose levels are high. And so that's what happens with insulin resistance. So that's the first step. And then there's usually pre-diabetes with that. And then later on, there's type 2 diabetes. So we're not talking about type 1 where the pancreas doesn't make insulin. We're talking about type 2. And so then, there's full-on diabetes. And then at a certain point, that pancreas is going to get real tired and it's going to stop working. And that's when they become insulin-dependent type 2 diabetics, which is super confusing. Now, GLP-1s, what I've seen clinically has been so different than what's been published. And so I'm trying to reconcile these two things. So in the very beginning of when we started using these for, maybe not the very, very beginning, but when I was aware of them being used in this capacity, I started paying attention. So patients were like, hey, can I try this? And I'm thinking, okay, well, you're pre-diabetic, you're obese, you have all these risk factors. I think you're a really good candidate to try this. Let's see. And so that was my first patient. And I monitor labs on these patients. So I usually in my practice monitor labs every 3 to 6 months on almost every single patient. I have very few that are just annual, mostly because my patients, once they know and understand their blood work, they want to keep on top of it and they like it. So it's different for them.
An accountability check.
Yeah. I mean, they just they want to know how their lifestyle is influencing. They want real-time feedback. They want to know how all those things in their life affected all of their markers. So, there's that piece. So I was monitoring this patient because he was on a medication now, and he had these comorbidities, we like to call them. And so in 3 months, his insulin went off the charts. And then his glucose went down. His hemoglobin A1C, which is an average of 3 months, went down. So it looked pretty. Now I'm thinking, hey, all these other doctors are just looking at fasting glucose and hemoglobin A1C. Are you guys pulling insulins? What's happening here? Wait, what's the mechanism of action? This makes sense. And so he continued. He ended up full diabetic. At that point in time, we were able to pull him back. He ended up going off because he really wasn't losing weight. And he was like, this is stupid, it really didn't work for him and he had to take some other avenues. The next patient went to our chiropractor's office, got one from someone in her chiropractor's office who was a physician, but not her physician. And so she just did it on her own. And I'm like, okay, well, we've been working with your glucose for a while. You're already kind of riding this line. Would you have a continuous glucose monitor? And we're monitoring her labs. And then I watch the same thing. Insulin goes off the charts, average blood glucose goes down and then it goes up, and then it kind of stays here. But so they're having these shifts. I'm like, okay, now people are starting to come into me and they're getting it online and wherever else. And, all these places are going to get it somewhere. And I'm monitoring their labs and I'm watching them all go from normal insulin levels to high insulin levels. And so I'm like, okay, so now you go to high insulin level, then all of a sudden you're, moving out of this. Now, diabetic patients don't respond that way because they already have high insulin. And I'm kind of oversimplifying because I'm just talking about the insulin here. So GLP-1 slow down motility, which is why people have constipation, but it also helps the satiation because food sits in there longer. That's why a lot of people have nausea with it as part of it. That's why, there's a bunch of lawsuits about gastroparesis now because the intestines can stop working. But there's lots and lots of mechanisms. And then the industries have figured out to microdose, which has been safer for people rather than doing diabetic dosing. And then they're seeing weight loss. And so when you see weight loss with people who have these comorbidities, even if they're not diabetic, then all the other things will improve because they're not eating as badly. So of course, maybe they're not eating at all. And so then their cholesterol gets better, and so what we'll see in the long term, I'm not sure. Now, for some of these people, did it retrain their brain? I've heard people say that, if I could just not
now they don't want
care
the fat
so much about food all the
sugar.
time. Yes.
Wow.
And then maybe they get weaned down. And a lot of doctors are starting to wean them off rather than take them off and step them down. And that seems to be more successful. So they are coming off. But I've also seen patients come in that were 118 pounds and 5'8", and that were just on it to lose 5 pounds. And I'm like, what freaking physician or nurse or whoever prescribed to you did this? Because this is medically irresponsible. And so in the midst of this, I'll kind of tell a personal story if you don't mind me rambling for a second. Before I did anything with my patients, I decided to experiment on myself because that's usually what I do. My poor husband, he gets dragged into everything. I'm like, hey, babe, we're going to wear continuous glucose monitors and we're going to do this micro dosing. And we decided to go with tirzepatide, which is Mounjaro. It's generic and it's safer. So it has a dual mechanism of action. So it works in 2 different ways. So it's not quite as strong. No, it's definitely as strong. It's just not as intense with side effects for most people, is what I would say. And so, we do the shot. I wake up in the middle of the night. I let her roll out of bed. I'm shaking on the ground. I think I'm having a seizure. And then I'm talking myself in my head and I'm like, oh, you're just having a panic attack. You're having a panic attack. I've had 1 panic attack in my whole life. And so I was like, why am I having a panic attack in the middle of the night? And then I'm like, my heart's racing. I can't breathe. I'm shaking. I'm sweating. I'm freezing. And I can't figure out what's going on. And this happens for what feels like an eternity. And I'm so nauseous. And then I'm like, no, dummy, you're sick. And then I crawl back into bed and whatever. And I finally fall asleep. And so my husband goes to work the next day and we got our monitors the next day. So we didn't put them on that day. We had to go pick them up. We didn't have them on. My husband goes to work the next day. He calls me and he's like, babe, I'm really sick. Something's wrong. And I'm like, what are you talking about? He's like, every time I stand up, I'm falling down. I feel like I'm going to pass out. I'm really dizzy. I'm shaking. I'm sweating. And he at the time was pre-diabetic. And so I was like, this will be even better to see too. I tend to have I have very good blood sugar. So I was like, this will be good to see on 2 different people. And I said, does anybody have a glucometer there? And so he goes and finds a glucometer. In the meantime, he drinks pineapple juice. And I think he had diabetic glucose taps.
Before he tested.
Yeah.
Okay.
And so I don't know what amount of time he had tested in the span. So it probably hadn't all hit him. At this point in time, his blood sugar is 53.
Wow.
After that. And I'm thinking to myself, so I've worn continuous glucose monitors a lot, and I tend to run low at night. I can get down into the, high 40s, and I have no symptoms at all. So now I'm thinking to myself, if I can be 48 and have no symptoms.
Where was I last night?
Yeah. And it took me 2 weeks before I could take more than 3 bites of food. I didn't go to the bathroom for 2 full weeks.
Oh,
he's like, you
gosh.
have to eat. I didn't lose a single pound, not a single pound. Yeah. So that's where we have to talk about, and we microdosed
you just
it.
Tanked. Both of you tanked, which, holy cow. Yeah. So people definitely don't understand what they're doing because they're working through a mechanism that they don't understand. They're just looking for the end result.
Yeah. And now we are finding, like you said before, we're finding that, people are losing weight because they're losing muscle mass and bone density. That's a concern right there. Now, if it gives somebody a little bit of boost and now they're working out, now they feel better and they get maybe some appetite control out of it and they feel really good. Maybe I think most things can be done well and most things can be done poorly. But if you leave it up to the public, to make their own medical decisions. They're not doctors, and that's not fair, and you shouldn't have put it in their hands.
Mhm.
So that's the issue. Like, oh, great. So you gave them Zofran to deal with the nausea, and then you gave them like, what?
Well, this is like the age of internet medicine.
Oh,
Like
gosh.
15 years ago, it was like, is my doctor back there Googling what to do with me? And now it's like people literally are getting their medical advice from TikTok, and it's a 19-year-old girl giving it to them. And so it fascinates me why medicine has not decided to get ahead of this prior to like 2023, because I just started seeing doctors post stuff, and not just like, oh, here's a disgusting video of my surgery, but actually talking about how things work from a
Yes.
trusted resource who's an expert in their field. And so I hope that, and I know you post a lot.
Yeah.
So I like the education behind it, but I wanted to wrap by telling people a little bit about just how fantastic it has been to have a provider who is so willing to go into depth explanation on things when I don't understand. And I like that you spoke about what type of doctor you wanted to become, because I experienced that with you myself. I was going through something really difficult, and you were right there with me. And you said, come on in, I'm going to help take care of you. And it was not just friendly. I really felt cared for by you. And I wanted to say thank you, because I don't know if I appropriately did or did not at that time. But, we all go through really difficult things health wise. Even like people are putting more focus on mental and emotional health now. And sometimes we just don't have a good resource. But I really ultimately have very high respect for you. I'm really glad that you came on to explain so many things that we just have no understanding of, especially the level of respect and education that naturopathic medical doctors actually go through. And so thank you so much.
Thank you.
Mhm. How do people get a hold of you?
Oh, so I'm in North Scottsdale. I'm at Princess and Perimeter. My clinic is Empower Integrative Health. The number is 602-345-1605. And then we also have social media. We're on Instagram. My office manager finally convinced me to get on TikTok. It's a brand new account, so it's got like nothing on there. And on Facebook, so they can follow me any of those places. And really, social media is me talking to my patients, and so I think people will definitely notice that. I'll be like, hey, this is what's happening, and yeah, and connecting with people. So it's not like me dancing around in videos and whatnot, which if they want that, there are plenty of people doing that. And sometimes, there's a little bit of everything on there for the social media part. But yeah, they can get a hold of me any of those ways.
Thank you so much.
Yeah.
I really appreciated having you on today, and we'll have to have you back.
Yeah, thank you so much for having me.
Absolutely. That has been today's episode of the Scottsdale Living Podcast. We'll catch you next time.